Hey, welcome back in. If you have questions about your pet's health, the number to call is 741-9272. Dr. Jerome Williams joined us once again to take your questions. Good to see you this morning.
Good morning. Good to be here.
Good to be here. We're just discussing earlier about dogs.
Right.
And sometimes you might see them and they're a little lethargic or
Right.
they're not eating right. And we know sometimes dogs, do they not have emotions? Can they not go in some sort of a psychological state, whether it's based on a medical problem or something?
Yes, they do. They can show depressive signs with the loss of their caregiver, their companion, even pain and other things that happen in a home or in their environment. They can pick up the emotions of the people, and then they can demonstrate some of those symptoms.
If you're dealing with that, should you put them in, try to get them in a normal routine, or try to get them in their old routine so that they'll maybe pick up some familiarity?
Well, first get them to your veterinarian. Make sure that's not a medical problem underlying it.
Okay.
And then if none is identified, then you can move toward getting them in an environment that they're familiar with.
All right. So again, if you have questions for Dr. Jerome Williams, the number to call 741-9272. We're winding down with the summer season, but it's, we know we're still going to get some warm days ahead.
Right.
So the ticks and the fleas are still going to be a problem.
There'll still be a problem, yes. And also, we're moving into another allergy season.
Okay.
It's another type of allergy that we're seeing now. We've begun to see that at our office already.
Oh, really?
Yes.
And what types of allergies normally are the issue?
It's normally the kind that from the ragweed, from the other grasses, the changing in the greenery as it dies and dries. So we're going to see the respiratory as well as the direct scratching and itching.
Okay, and normally how would you treat something like that?
And you can always try initially at home to give Benadryl. It's given at 1 milligram per pound, 2 to 3 times a day.
Okay.
That may work to get you over a real short period of outbreak. If that doesn't work, then go see a veterinarian.
All right. So now we do have a caller on the line. Lynn is hanging on for Dr. Jerome Williams. Lynn, how you doing this morning?
I'm doing fine. How about you?
Doing well. What's your question?
My dog is 13 years old. She's a little bit of a large dog, but she's developed cataracts, and she seems to be afraid or hesitant to go outside at night. Would the cataracts be hindering her eyesight at night?
Yes, because the cataracts prevent light from going back to the part of the eye that really can see images. So she's going to have difficulty in dim light and also going up and down steps or stairways. So
that was my next question.
Yes, those are the times you're going to see the problem most now. We have 3 excellent ophthalmologists in town, so you might want to get her to see one of those and get her evaluated.
She also has an infected cyst on one of her paws. So
now that can be addressed. If you're speaking of right between the toes, it's called an interdigital cyst, and usually those have to be surgically removed. But your doctor can tell you really what's required to get that corrected.
Okay, thank you very much. I appreciate it.
All right, Lynn, thank you so much for the call. Appreciate that. I think we got another caller on the line. And if you'd like to get in, the number call 741-9272. All right, we got about 20 seconds to wrap, but my dog dealt with the same thing with the cataracts.
Right.
That is it's just something that's going to happen when dogs get older, isn't it?
Yes, it's one of the things that does happen. Dr. Nams, that was on with us earlier this month, brought her dog on that she had done the cataract surgery on.
Okay.
And it's a common surgery now. If a dog lives long enough and get old enough, that's one of the things you probably going to have to deal with.
Okay. And we understand there's a special picture you want to show.
Oh, yeah, that's my mom. She is
Or she turned 30, is that right?
that was her 99th birthday celebration. Mama's had some illnesses lately, and she is recovering now
bless her heart.
at Princeton.
Okay.
Thanks to the excellent care of the people there, and Dr. McWater and her granddaughter, Dr. Sonia Pettis. So we're so happy for the support that we have gotten in her diagnosis and recovery from this from the illness she's
Awesome.
had.
Well, I hope she's watching this morning, and we wish her a speedy recovery as well. Dr. Jerome, thank you so much.
Thank you.
All right.